Now, the Pharmaceutical Society of Ghana is urgently calling for the supply of affordable essential medicines through the National Health Insurance Authority for victims of the Akosombo Dam Spillage. This incident has displaced numerous residents in the Lower Volta Basin. The association insists that these medicines must be made available to treat underlying health conditions amongst victims.
Following the spillage of the Akosombo Dam and the subsequent displacement of residents in the Volta region, health concerns are escalating to prevent outbreak of diseases in the affected communities. President of the Pharmaceutical Society of Ghana, Dr. Samuel Kodonko says flood-affected victims may be grappling with chronic conditions. He says the association is actively working to diagnose and provide appropriate medications.
But one thing we know for sure, that some of these patients might be having some chronic conditions like hypertension. They could have some chronic conditions like diabetes. And we could also be some waterborne diseases because of the flood and all that. So these are things we expect to find through the various investigations that will be conducted, and therefore we'll be able to make the appropriate diagnosis and the appropriate medications would also be given. We also even expect that some of the children and others here could also be infected with maybe some worms, and therefore there will be need for them to also be dewormed at this time. So it's quite a range, cutting across from various infectious diseases through chronic diseases like we mentioned, hypertension, diabetes. It's even possible to also, and even skin. Skin care could also be a problem. So these are all conditions that we are expecting to come across, and we have the needed medications to be able to afford them once the physicians and the clinicians prescribe. It's also important to know that the laws of the country allows pharmacists to treat ailments, diseases of common occurrence, pharmacists to be able to manage certain conditions. So we have quite a number of pharmacists here. We know the numbers are huge here, but the pharmacists would also be able to provide the needed care.
Dr. Donko further added that health facilities in flood-affected areas facing stocking challenges will receive necessary attention to ensure the delivery of proper health care.
Millions of medicines, as pharmacists, and that's why we have quite an exhaustive list of medicines here available. So the CHIPS compounds and all the other health facilities here who are currently maybe understocked or maybe deprived of certain essential medicines will make donations through the District Health Directorate, and through the District Health Directorate they will be able to access the medicines. But it's also important to note that the pharma care we are providing still is a multidisciplinary approach that we are using. We have nurses here to support the pharmacist. We have medical doctor here to support the pharmacist. We have physician assistant. And we also have the lab scientist. So it's a kind of comprehensive medical care we are providing, comprehensive health care we are providing.
Volta Regional Chairman of the Pharmaceutical Society of Ghana, Dr. Courage Edem Keto, urged the government to make essential medicines readily available and affordable on the NHIS in flood-affected areas.
We are mainly concerned with the pharmaceutical care needs of the people as members of the healthcare team. So, call to government will have to do with supply of essential medicines, affordable essential medicines on the NHI list. Thank God today, through the arrangement by President, we have NHI on the grounds to register and renew the cards of those who have had their cards inactive because of the flood. They have lost their livelihoods. So the association has made provision for the NHIA cards to be renewed so that the financial barrier of the people seeking care will be curtailed. So our call to government is to ensure that medicines are readily available and are affordable on the NHI list so that these people can access good care, so that our therapeutic outcomes that we all wish to achieve will be achieved.